Okay, so now you know officially that we are recording at this time. Okay, so do you have any questions at this moment from the lecture exam experience that you just had? Okay, so not hearing anything?
For the
I can hear you.
label, like the part like on the body where you had to like label the different areas, is that 1 point each?
Yes, Jamie, it is. Okay. And please be assured that I will be reviewing all the content. So, you know, the score that the computer gave you this morning is definitely not your final grade. Okay. So I will be looking over everything and returning points to you as I can.
Okay.
So like,
Go
if
ahead,
we,
Abby.
sorry. So if we
Okay.
spelled something wrong, like by a letter or something, will you give points back for that? If
Yes,
it's like a letter off?
yes, Abby, you will.
Okay.
As long as I can interpret what you are trying to communicate, typically I do give those points back. Elena, do you have a question?
Yeah, on the essay ones, do we get partial credit if we got some part of it wrong?
Of course, yes, of course. Okay. I'll be taking a look at everything you provided. And if you had some information that's correct and other that's not correct, you will get partial credit.
Is there always going to be less than a minute per question?
Please repeat that, Alyssa.
Is there always going to be less than a minute per question? I mean, like with the essay questions combined, like technically there's like pretty much, I mean, like 93 questions, all of the things listed out. With answering those essay questions, they clearly take quite a lot of time, and we're allotted less than a minute per. Is it always going to be like that?
Yes, Alyssa, it will be. Okay. In a normal semester, if we were all taking the exam in the classroom together, you would have 85 minutes and you would have a note card that you'd be allowed to take notes with and bring it into the exam space with you to take the exam. But yes, you can expect that 85 minutes is going to be our time limit, except for the final exam. For the final exam, you will have 2 hours.
Okay.
Any other questions?
Were we allowed to bring in a note card for this test? Since you said that like on campus you can.
Well, tomorrow, it's a good question. And you know, I'm not really speaking to what you can or can't do because I can't control your testing environment. What I mean is you're testing at home. So if you want to have your notebook open right beside you or your textbook open right beside you, which I expect is probably happening.
But that would be cheating. So
right, Tamara, it would be dishonest, but since I can't control that, you know, I leave it up to you and your conscience as to what you want to do.
okay. Thank you.
Okay. Anything else? I know it's always difficult because, you know, if you took the test honestly and didn't have your notebook or your textbook open, it feels rotten when you get a lower grade than somebody who had the book open. I get that. Unfortunately, this is humanity, right? This is what life is about. So you do what your conscience will allow you to do. Okay. Okay. Any
So the
other
test
questions?
showed, the test rated it at 93. There was 93 sort of questions per se. So I'm taking that was 1 point for every single thing, every single answer that we had to give.
The exam was 93 points. There were not 93 questions.
Okay, so 93 points, that's every answer we had to give. But technically it was a 44 question exam.
No, technically it was a 20 multiple choice, 20 fill in the blank, and 4 essays with multiple questions within each essay exam. Okay, so among that content, you would have earned a maximum of 93 points.
I got it.
Okay, and remember, the points really don't matter because everything's calculated based on percentages, right? So it doesn't matter if the exam was 100 points or 75 points or 183 points, your grades are calculated based on percentages. Okay, anything else? Okay, all right, folks. Well, welcome back. Let me say that, I will do the best that I can to return the exams to you as quickly as I can. I do have a lot of other things I need to achieve this week because of my training conference. So it will be a little slower than usual, but I will do my best to get the exams back to you. Maybe I will try to have them back to you by Saturday. I will try to do that, okay? So moving forward, let's talk about our schedule here. Obviously on Thursday, there is no lab. So welcome to anybody here now that normally attends a Thursday lab. There is no lab Thursday. There is a lecture on Thursday, normal lecture at 8 a.m. with Professor Mason. And I sent out a Zoom link in last week's email about that. So you should have received that. So please attend lecture on Thursday. The following week, next week, Monday and Tuesday, as you know, is fall break for HAC. It's fall break. And what that means is that there are no classes Monday or Tuesday of next week. The school is officially open, but there are no classes Monday and Tuesday of next week, okay? So that means since there is no lab next Tuesday, there's also going to be no lab next Thursday because I need to keep you folks balanced, okay? So we are going to have a 2-week window before we're back together in lab, okay? So I'll talk more about that in just a moment, but just keep in mind that next week there is no lab and next Tuesday there is no lecture because of fall break. So the next time we meet again is going to be Thursday. A week from this Thursday, we will be meeting again for lecture, okay? So we do have a little bit of a break, which can be good, can be bad, depending on your perspective, right? It's nice to have a break, but you do want to be sure that you're staying up with the content because you don't want to get behind, okay? All right, so any questions about that schedule? Okay, so for today, there were 2 homework assignments that were due. Those are lab exercises 11 and 6. We're going to go over those in just a moment, okay? And the next time we meet for lab, which is 2 weeks from today, okay? So the next time we meet would be the 20th of October. You have lab exercises 12, lab exercise 14 due, and those are very beefy exams, so to speak. They're exercises. There's a lot of work there for you to do, okay? So you want to be making sure that you bear down during your break period and finish that. There's also going to be a histology handout packet that I'm going to give you in this afternoon's email, okay? So you have 3 things that are due for lab in 2 weeks. They are lab exercise 12, lab exercise 14, and the histology packet that you will be receiving today in email, okay? So let me show you what the histology pack is going to look like. Just a moment. Okay. I'm going to to share my screen with you. And let's see here. I need to find this. Okay. All right. Okay. All right. So you are going to receive a histology packet that contains pictures of tissues. So on my screen right now, you should see an image of a tissue with page 1 in the upper right corner. The tissue has some brackets with letters, some arrows with letters, some boxes with letters, and there's multiple pages of these things. And so what you are to do as part of your work over the next 2 weeks is go through these pages and try to identify everything that's marked with a letter. For example, in box A here, what is this cell? You know, what is this tissue? What is this cell? In box C, what am I trying to show you? With arrow D, what is arrow D pointing to? What is arrow E pointing to? So the idea is that you print out a copy of this packet for yourself, and you try to identify all the structures that are labeled with a letter. Okay, that's really the most important thing. There is some note-taking space to the right where you could write some comments about the structure, what its purpose is, what its function is, something that might be a memory or learning trigger for yourself. Okay, but the idea here, again, is that you start getting comfortable with the visual appearance of tissue. You start getting comfortable identifying the tissue that's in front of you and what the tissue is made of. This is not an easy or trivial skill. And as you know, you did have a lab homework assignment, lab exercise 6, which was about the tissue. So you've already done that for today's lab. So hopefully that will help you continue to prepare by doing this homework. Okay, for lab exam 2, you will have to identify the muscles of the skeleton muscle word bank, and you will have to identify some tissue pictures as well. Okay, so this is all to prepare you for your next lab exam. Okay, next lab exam for the Tuesday group is October 27th. For the Thursday group is October 29th. So we're a little less than a month away, okay, about 3 weeks. Okay, so just as an example, let me ask you a question about this thing on your screen. Okay, so in the chat window, please tell me okay, in the chat window, what kind of tissue are you seeing on your computer screen? Can you identify this? Predominantly bracket A. Bracket A, what kind of tissue is bracket A? What kind of tissue is bracket A? Do we have any guesses at all? Just take a guess, folks. Do you have any guess at all what kind of tissue you're looking at? Okay. All right. So a few people are guessing, and I appreciate that. I will say that this is a type of connective tissue, but on your exam, of course, I won't accept that. You have to tell me specifically what form of connective tissue this is. All right. I have every confidence that when you begin to do this work and look at chapter 4 of your textbook, you will recognize that in fact this is hyaline cartilage. Okay, bracket A is hyaline cartilage. That's what this is. Okay. All right, gang. So that's what I'm going to be asking you to be able to do for lab exam 2. Lab exam 2. Okay. All right. So do you have any questions about the tissue packet? Okay, this will be coming out in this afternoon's email. You will receive it today. Okay, so lots of challenges waiting ahead for you. Okay, all right, folks. Okay, so do you have any questions about our upcoming schedule? Okay, as I said, no lab next week, no lecture next Tuesday because of fall break. Okay, all right then, folks. Let's see what we can accomplish here this morning. So let's take a look at the homework that was assigned to you. Okay, that was lab exercises 11 and 6. 11 and 6. So if you would please get out your completed homework. Let's take a look at lab exercise 11 first. Please turn to page 171, 171, where we have reviewing your knowledge. Okay. Letter A, the structural and functional classification of joints. Okay. All right. So let's see here. I'm going to continue through the virtual room here and ask each of you to contribute a little bit. Okay. All right. Okay, so letter A, page 171, structural and functional classification of joints. Okay. Let's see, Julia Mylan. Julia, could you please give us your answers for 1 through 7?
So for 1, I had diarthrosis. For 2, I had synarthrosis. 3, amphiarthrosis. 4, synovial. 5, cartilaginous. 6, synovial, and then 7, fibrous.
Okay, nicely done, Julia. That was exactly correct. Let me repeat that. Number 1, diarthrosis. 2, synarthrosis. 3, amphiarthrosis. 4, synovial. 5, cartilaginous. 6, synovial. And 7 is fibrous. Okay, letter B, the basic structure of the synovial joints. Abby Martin. Abby, can you please give us 1 through 5?
For 1, I had articular cartilage. For 2, I had synovial fluid. 3, I had hyaline. 4, I had bursa. 5, I had synovial membrane.
Okay, thank you, Abby. Yes, for number 1, if you had articular cartilage, that would be correct. But if you had hyaline cartilage, that would be correct because they are the same thing. Okay, so number 1, hyaline cartilage. Number 2, synovial. 3, hyaline or articular cartilage. Number 4, bursa. Number 5, synovial membrane. 5 is synovial membrane. Okay. All right. Do you need any of page 171 repeated? Okay, let's turn the page to page 172. Letter C, the types of synovial joints. Okay, Elena, could you please give us 1 through 6? Elena, I can't hear you.
I don't know what I wrote here. Number 1, I put pivot. I'm not quite sure what I was thinking there. 2nd is condyloid. 3, ball and socket. 4, planar gliding. 5, hinge, and 6, hinge.
Thank you, Elena. There were a few errors there, so let me correct them. Okay. Elena, you seem to be unsure of why you answered pivot for 1, but number 1 is pivot. That's the correct answer. Okay, so number 1.
I misspelled it here.
Okay, okay.
Like, what is that? Okay.
Okay, so 1 is pivot. 2 is ball and socket. 3 is hinge. 3 is hinge. Okay, 4 is a planar joint, a planar, or you might sometimes refer to it as a gliding joint. 5 is saddle, and 6 is condyloid. 6 is condyloid. Okay, so obviously that is a topic we haven't gotten to in lecture yet. We are going to be doing about a single lecture in a week or two on the joints, so you will get some help with that. But you know, we're moving ahead, right? We're continuing to push forward here. Okay, so very quickly again, letter C, number 1 pivot, 2 ball and socket, 3 hinge, 4 planar, 5 saddle, and 6 condyloid. Okay, Jamie Reber, Jamie, please give us 1 through 6. 1 through 6.
Okay, for 1, I had adduction. 2, I had extension. 3, depression. 4, supination. 5, plantar flexion. And 6, flexion.
Okay, nicely done, Jamie, and very nice enunciation of your words, because that's very important, because some of these terms sound similar if you're not careful. Number 1 is adduction with 2 D's, ADD, adduction. 2 extension, 3 depression, 4 supination, 5 plantar flexion. Okay. 5 is plantar flexion and 6 is flexion. Alyssa Singley. Alyssa, can you give us 7 through 11, please?
Yeah. So for 7, I have abduction, 8 rotation, 9 elevation, 10 proctation, and 11 inversion.
Okay, thank you, Alyssa. Nicely done. Once again, 7 was abduction, ABD, abduction. 8 rotation, 9 elevation, 10 protraction, and 11 inversion. Okay. Folks, do you need anything on page 172 repeated? All right, let's go to page 173 using your knowledge. Letter A, the synovial joints. Okay. All right. Devora, are you able to give us numbers 1 through 5 on page 173?
Yes. For number 6, it's articular cartilage. Number 7 is synovial fluid. Number 8 is femoral. Number 9 I don't have, and then number 10 is femoral head.
Okay, Devora, your numbering is off there. Can you give us on page 173, can you give us 1 through 5?
Oh, I'm sorry. Number 1 is articular cartilage. Number 2 is synovial membrane. Number 3 is fibrous membrane. Number 4 is articular cartilage. And number 5 is articular collapsal. I think I'm saying that.
Okay, that was more reasonable, Devora. Thank you. Let me just clarify. Number 1 was the articular cartilage. 2 is the synovial cavity, which you could also refer to it as the glenoid cavity. So 2 is synovial or glenoid cavity. 3 is the articular capsule, which you may have also referred to it as a fibrous capsule. So 3 is articular or fibrous capsule. 4, again, it is hard sometimes to know exactly what's being pointed to. I get that. So for 4, we would want you to say either articular cartilage, or you might have referred to the trochlear notch. So 4 is the articular cartilage or trochlear notch, depending on how you interpreted that image. Number 5, once again, is the articular capsule or the fibrous capsule. Okay, let's see here. Diana Manzi. Diana, can you please give us 6 through 10 on page 174.
Six is head of femur. 7 is joint cavity. 8 is greater trochanter. 9 is ischium, and 10 is anatomical neck of femur.
Okay, thank you, Diana. A few, pretty good, but there's a few points that we would need to clarify. Okay, for number 6, I believe you mentioned the head of the femur. If you look very carefully at the picture, the line is on the structure of the acetabulum. So 6 is acetabulum. 7 is synovial cavity. 8 is the greater trochanter of the femur. 9, believe it or not, is actually the ilium. It's not the ischium, it's the ilium. And 10 is the head of the femur. 10 is the head of the femur. Okay. All right. Letter B, page 174. Christopher, can you please give us 11 through 15? Okay, so Christopher is responding in the chat window. Okay, thank you, Christopher. Most of that is correct, but there are a couple errors there. Okay, number 11 would be flex. Number 11 would be flex. 12 is dorsiflex. 13 is extend. 13 is extend. 14 is extend. And 15 is plantar flex. Okay, so you got most of them right, Christopher. Okay. All right. Folks, do you need any of page 174 repeated? Okay, number 8. Number 8 was the greater trochanter of the femur. The greater trochanter of the femur. Okay, anything else? Okay. All right, folks. So thank you for wading through that. Again, you are going to get a little bit of help with that in lecture in a week or two. We will be talking about some basic characteristics of joints. Okay, let's do the second part of our homework assignment, which was lab exercise 6. Okay, lab exercise 6, where you looked at the tissues. All right, please go to page 77. Excuse me, page 77 of your lab manual. Let's take a look here at reviewing your knowledge, page 77. Letter A, the primary tissue structure and function. Okay. All right, so let's see here. Tamara, can you please give us 1 through 7, please? Please give us 1 through 7.
Professor Allen, I was confused and I was going to do it today and Wednesday for Thursday. Like lab, I often do it on Tuesday and Wednesday, like the questions. And I forgot that it was on Tuesday. So
Tamara,
I didn't do it.
Tamara, are you normally a Thursday student?
Yes.
Okay, so no
But, I
problem.
mean, you can point dock points if you whatever. Like
No. I would not do that. Okay, so you're fine. You're fine. I understand. So I'm just going to move past and thank you for your honesty.
Thank you.
Ashley Cruz. Ashley, are you able to give us 1 through 7?
Yes, for 1, I have nervous tissue. For 2, I have muscle. For 3, I have connective. For 4, I have epithelial. For 5, I have epithelial. For 6, I have connective. And for 7, I have muscle.
Okay, thank you, Ashley. Those were almost perfect. There was one small error, so let me review those. Number 1 is nervous, 2 is muscle, 3 is connective, 4 is epithelial, 5, 6, and 7, because there's a bracket there on page 77, 5, 6, and 7 are epithelial, muscle, and nervous. Epithelial, muscle, and nervous. Okay. Nexani, are you able to give us 8 through 15?
Yes. So 8 is epithelial, 9 nervous, 10 muscle, 11 epithelial, 12 connective, 13 epithelial, 14 nervous, and 15 skeleton.
Okay, thank you, Nexani. Again, very nice. A few weak points, though, that we need to clarify. Numbers 8, 9, and 10. 8, 9, and 10 are epithelial, muscle, and nervous. Number 11 is connective. 11 is connective. 12 is connective. 13 is epithelial. 14 is nervous. And 15 is muscle. 15 is muscle, okay? Remember, muscle tissue is the only tissue that looks striated. It's the only tissue that looks striated, okay? All right. Do you need anything repeated from page 77? Okay, let's turn the page to page 78. Letter B, the epithelial tissues at the top. Letter B, page 78. Okay, Maria Salter. Maria, can you give us 1 through 7?
Yep. I had stratified squamous, simple cuboidal, pseudostratified ciliated columnar, simple squamous, simple columnar, and transitional.
Okay, Maria, that was perfect. Thank you. Let me repeat. Letter B, number 1 is stratified squamous. 2 is simple squamous. 3 is simple cuboidal. 4 is pseudostratified ciliated columnar. 5 is simple squamous. 6 is simple columnar. And 7 is transitional. Okay. So everybody's had a chance to contribute, and thank you for that. So I will finish this out, folks. Okay, starting with letter C, the connective tissues on page 78. Number 1 is elastic tissue. 2 is dense regular tissue. 3 is hyaline cartilage. 4 is areolar. 5, elastic cartilage. 6 is spongy bone. Spongy bone, which is also sometimes known as trabecular bone. Spongy or trabecular bone for number 6. 7 is reticular. 8 is dense irregular. 9 is blood. 10 is adipose. 11 is compact bone, which is also known as cortical bone. So 11 could be compact or cortical bone. 12 is fibrocartilage. Okay, and then 13 through 18 on page 79, 13 through 18 are in brackets. So I'm going to read off the answers to 13 through 18. 13 through 18. They are areolar, reticular, adipose, dense regular, dense irregular, and elastic. Okay. 19 and 20, also in brackets. 19 and 20 are compact bone and spongy bone. 21 through 23, again in brackets. So 21 through 23 are hyaline cartilage, elastic cartilage, and fibrocartilage. Number 24 is blood. 24 is blood. Okay. All right. Do you need anything from letter C, the connective tissues repeated? Okay, not seeing anything in the chat window, I will continue. Letter D at the bottom of page 79, the muscle and nervous tissue. Number 1 is smooth muscle. 2 is skeletal muscle. 3 is cardiac muscle. 4 is nervous tissue. 5 is smooth muscle. 6 is smooth muscle. Okay. All right. If we turn the page, we have page 80. We have all these pictures of epithelial and connective tissues. Let's see how you did with this. Okay. Remember, folks, that a great deal of disease diagnosis represents a great deal of disease diagnosis lies on a solid foundation of tissue biopsy, right? Tissue biopsy. When a tissue is biopsied, you take a small sample of a patient's body and you section it in the lab, and an expert evaluates the quality of that image under a microscope to see if there's disease present or not, right? Certainly right now, there's somebody sitting in a doctor's office getting the news that they have some tumor or cancer in them based on a biopsy. Okay, so this may seem like a very tedious activity we're asking you to do, and it is, but so much of what we rely on in medicine is biopsy information. Okay, letter E, number 1. Number 1 is pseudostratified, ciliated, columnar epithelium. Number 2 is stratified, squamous epithelium. 3 is transitional epithelium. 4 is simple columnar epithelium. 5 is simple cuboidal epithelium. 6 is simple squamous epithelium. Let me see here. Number 6, believe it or not, is actually a section of your lung tissue. It's a section of lung tissue for picture 6. Okay, number 7 is dense regular connective tissue. 8 is compact bone. 9 is elastic connective tissue. 10 is areolar connective tissue. 11 is hyaline cartilage. 12 is adipose tissue. 13 is blood. 14 is dense irregular connective tissue. 15 is reticular connective tissue. 16 is elastic cartilage. 17 is spongy bone, which you may have also indicated as trabecular bone. 18 is fibrocartilage. 18 is fibrocartilage. Okay, so would you like any of those from pages 80 and 81 repeated?
Can you repeat number 1, please?
Okay. Okay, number 1 is pseudostratified, ciliated, columnar epithelium. Okay. Anything else? Okay, folks, hang in there. I know you're exhausted. I can see it in your faces. Okay. Page 82, muscle and nervous tissue identification. Page 82, letter F, number 1. 1 is smooth muscle, smooth muscle. 2 is nervous tissue. 3 is skeletal muscle. And 4 is cardiac muscle. 4 is cardiac muscle. Okay, so question coming in the chat window. How do you distinguish pictures 3 and 4 on page 82? How do you distinguish them? Okay, all right, fair enough. So I think probably the most realistic answer is the one that Abby gave us in the chat window, which is the presence of the intercalated discs. Very nicely done, Abby. Another question. What 2 cell junctions are found in the structure of intercalated discs? Okay. Desmosomes are present, Abby. That's right. That provides structural stability so the cardiac muscle fibers don't tear themselves apart during heart contraction. What's the other junction that's going to be critical for the transmission of the electrical signal? Okay, Julia, good job. It's gap junctions. Good. You work together, you got it. Good job, Elena. Nice. Okay. All right. Okay, folks, let's go to using your knowledge, page 83. Page 83. Letter A, genetic diseases and tissue function. Okay, so you were to look up these diseases, identify the abnormal protein, and state how the abnormal protein affects the function of the tissue. Okay. All right, so obviously everybody would have potentially worded their description and explanation differently. So you're looking for general ideas to be sure that you are correct or not. Okay, so number 1, we're talking about cystic fibrosis here. Number 1, the name of the abnormal protein. Get a load of this, right? Number 1, the abnormal protein is called the cystic fibrosis transmembrane conductance regulator protein, right? 6 words there. Cystic fibrosis transmembrane conductance regulator protein. This is the protein that transports chloride ions across the plasma membrane of the epithelial cells into the mucous membranes. Number 2, what is the effect of the abnormal protein on the tissue function? If you have a defective transporter protein, it will decrease or lower secretion of chloride ions and increases reabsorption of sodium and water across the epithelial cell membrane. The increased reabsorption of sodium and water causes the mucus to be abnormally thick. I mean, I think most folks know with cystic fibrosis, you have this very difficult thick mucus. It makes it hard to breathe. Okay. When you have the thicker mucus, that increases your risk of inflammation, risk of infection in your lungs, risk of infection in the pancreas, the GI tract, and in some cases, it can even clog some of your exocrine glands. It can block the secretion from the glands. So suffice it to say, it's not a pleasant disease. Okay. 3 and 4, where we talk about Duchenne muscular dystrophy. Okay, the abnormal protein for Duchenne muscular dystrophy is a protein called dystrophin. Folks, as someone who focuses on genetics myself, there are over 50 medically documented variations of the dystrophin protein that lead to disease. What I'm trying to tell you is there's 50 different malfunctions in the dystrophin protein that lead to 50 slightly different versions of muscular dystrophy at the molecular level. Okay, you have one protein that can have 50 different malfunctions leading to 50 different related but unique disorders. That is very difficult to handle, right? It's very difficult to treat this disease. One of the reasons it's hard to treat muscular dystrophy is because the damn protein is so large. It's so large. And so getting some form of genetic therapy into the cell to correct a large protein is really a technology challenge. It's something we can't do yet. We don't have the technology to do it. Okay. All right. So number 4, what is the effect of the abnormal protein? The defective dystrophin causes the sarcolemma, which is the plasma membrane of the muscle cell, to physically tear during muscle contraction. This causes the muscle cells to die, right? It weakens the muscle cells and they die. So loss of muscle mass occurs and eventual loss of function, right? Can you imagine if you had, let's say, your respiratory muscles that you need to breathe would atrophy and begin to die, right? Your diaphragm and the intercostal muscles of your rib cage, if they're not working correctly, you're going to have a hard time even bringing air into your body. So it's a very debilitating situation. Okay. All right, folks, any questions about 1 through 4? Right. I mean, you have to ask yourself, why are you putting yourself through this very intense, rigorous educational process? It's because someday we want to be able to successfully treat and preferably even cure some of these disorders, right? And it's really a challenge. I mean, this is no small task that we're asking. Okay, so let me ask you, do you personally know anyone with muscular dystrophy or cystic fibrosis? Okay. Okay. All right. So my point here is if you don't know someone, that sometimes when you don't know someone personally, right, the issue doesn't seem as important. And I'm as guilty of that as anyone because I don't personally know anybody with muscular dystrophy. So I don't lay awake at night worrying about it, right? But yet to somebody and to somebody's family, this is a very, very serious situation. I do happen to know somebody with cystic fibrosis. And in fact, that somebody I know passed away a few years back. So it becomes personal, right? It's the personal feelings behind these conditions, which should be the motivator for why we're working so hard to understand how the body functions. All right, you have to ask yourself, why am I doing all this hard work? It's because we want to be able to handle situations like this. Okay, Let's see here. Let's continue. Letter B of page 83, nutritional deficiencies and tissue function. Okay. So we're talking about scurvy and connective tissue here. Okay, for scurvy, the nutritional deficiency is vitamin C, right? And so I'm sure you've heard of scurvy from your old childhood days of thinking about pirates and pirate ships, right? Scurvy. All right. Number 6, describe the extracellular matrix changes and symptoms. Well, if you have a lack of vitamin C, this will lead to poor collagen formation. Question in the chat window. What is the most abundant protein in your body? What protein do you have more of than anything else? What protein do you have more of than any other protein? Thank you, Elena. It is collagen, right? It's collagen, right? We've been talking about this. Collagen is the most abundant protein in the body. So with a deficiency in vitamin C, you don't make the collagen very efficiently, and that has all kinds of consequences. For example, it will result in loose teeth. Your teeth get loose. It can result in abnormal bleeding from your blood vessels. It can result in an inability to heal your wounds. Like if you cut yourself or you have some kind of physical trauma, your wounds will not heal very well. Okay, so that has quite significant consequences. Okay. All right, folks. Page 84, letter C. Personally, I feel that letter C is probably an insane sort of question. And so, you know, I'm never going to ask you anything like question C on an exam. So I'm a little resistant to answering that. So let me ask you in the chat window. Do you want the answers to 7 through 10 on page 84? Because I don't feel that they're terribly important at this moment. Do you want the answers? Okay, Elena, you would like the answers. All right, I'll give them to you. There's a lot of words here, and I would not expect that you got this perfectly correct. I wouldn't expect it, okay? All right, so you are to list the tissues in order from the lumen to the outer surface, from the lumen to the outer surface. Number 7 is for the esophagus. Here we go, folks. Starting with the lumen. First, we have non-keratinized stratified squamous epithelium. Next, we have areolar connective tissue, which is called the lamina propria. After that, we have smooth muscle tissue, which in that location is called the muscularis mucosae. After that, we have areolar connective tissue. After that, we have skeletal muscle in the upper and middle portions of the esophagus and smooth muscle tissue in the lower portion of the esophagus. And finally, it finishes with areolar connective tissue. Okay, so folks, do not stress out if you found page 84 to be rather obnoxious to do. Okay, I'm not going to pound you with it. Number 8 is the small intestine. Small intestine, starting with the lumen, which you know is the hollow space, right? Number 8, simple columnar epithelium, followed by areolar connective tissue, followed by smooth muscle, followed by the duodenal glands, followed by smooth muscle, followed by areolar connective tissue, and simple squamous epithelial tissue. So if you got any of those in the correct order, I think you should feel good about that, okay? Number 9 is the trachea, your windpipe, Okay, number 9, we start with pseudostratified, ciliated, columnar epithelium. Then we go to the lamina propria, which contains elastic and reticular fibers. Then we go to areolar connective tissue. Then we go to a layer of hyaline cartilage. Then we go to areolar connective tissue. Number 10 is your ureter. Okay, your ureter is the tube that connects your kidneys to your urinary bladder. So the ureter, we start with the transitional epithelium. We go to areolar connective tissue. We go to smooth muscle. And then we go finally to a layer of areolar connective tissue. Okay. All right, folks. Folks, do you need any part of using your knowledge, pages 83 or 84 repeated? Okay, all right. All right, folks, thank you for your continued hard work. Your dedication to the course is going to pay off down the road, okay? I know it may not feel that way now because you're exhausted, but you got to know it will pay off, and your future patients are going to be grateful that you know more than the average Joe coming off the street, okay? All right, so, okay. So folks, I see the fatigue in your eyes. I can see it in the windows. So here's what I'd like to do. I'd like to set us all up for a single breakout room session where we make some attempt to help each other learn some of the skeletal muscles. And then after that, I'll give you the option of heading out, okay? Do you have any questions before I organize you into breakout rooms? Okay, so please give me an indication through the video cameras or in the chat window. The last time we met, I did assign you a specific section of the word bank. Is that correct? Okay. Now, I do realize that you probably spent most of the last week getting ready for your lecture exam because that's really what you should have done, okay? So I don't anticipate that you are necessarily that more advanced with your knowledge today than you were last time, okay? But what I'd like to do is do one breakout session, give you a chance to present the content that you are currently learning, and give each other a familiarity with certain muscles as you are able to do that. After that, we'll regroup. I will field any questions you might have, and then I think we'll call it quits for today because I have no preconceived notions that you can take an exam at 8 a.m. and still be focusing, you know, at 11:30 effectively, because everybody needs a bit of a break. Okay, so folks, let's do one breakout session, okay? And before I do that, let me mention, I'm now going to stop the recording because the rest of the time is going to be study time. So people viewing this, you know, they have all the answers to the homework. Everything they need is now recorded. So I'm going to stop recording. And I will post this video to YouTube and send you a link in this afternoon's email.